WBZ's Dr. Mallika Marshall joins us now live to answer your coronavirus questions. And we're going to start with our first question from Debbie, which is, Doctor, do you know anything about the new variant of COVID?
Nothing at all. No, actually, I do know something about the variant. First of all, the World Health Organization says that there are at least 4 subvariants of the Omicron variant, including the BA.2, which has started to circulate here in the United States. Now, studies suggest that it is more transmissible than the original Omicron variant, but so far evidence does not suggest that it causes more severe disease or that it's better able to evade the vaccines we have currently.
Ugh, all right. Rob from Natick writes, I just bought some KN95 masks, but read online that they should be discarded after 5 years. Why is this necessary?
So apparently it's not the mask itself that it can degrade, but it's actually the elastic straps that are sensitive to sunlight and to extreme heat and cold and can make it so that the mask doesn't fit properly. And that's what you want to get, is a good seal. So it's really important to try to store your mask someplace where it's dry and dark. Here in our house, we tend to store them in a wooden box in the family room. It's a pretty box. It's a decorative box, but it is a wooden box to keep them safe.
So they look good when they're in storage. Michelle from North Dartmouth asks, I heard you say on TV one night that KN95 masks should have the GB2626-2006 code actually printed on the mask. The masks I have only have KN95 written on the mask, but not the GB code. Are they legitimate?
So it's my understanding that you really want to have one of those 2 GB codes imprinted directly on the masks themselves and not just on the packaging. And there are a couple of other things you can look out for to make sure that your masks are legitimate and not fake. That is, you want them to arrive in sealed packages and not in a bag that's tied with a string, for example. You want to make sure that there is an expiration date that you can find somewhere on the packaging. And the company really should include not only its name, but a website and a contact number that you can use if you have any questions or concerns.
Right, because we know there are a number of places that are selling not real masks. This is a way to tell what's authentic. Faith wants to know, what are your thoughts on monoclonal treatment for symptomatic patients?
Okay, so right now we have 2 main types of treatments for the outpatient setting. That means for patients who are outside of the hospital, and these are ones who are at moderate to severe risk for COVID-19. So the first one is monoclonal antibodies, which you mentioned, which a lot of people have heard about. These are antibodies that are actually given to patients through an IV infusion, need to be given within 10 days of the onset of symptoms. The other category are pills. We've got 2 antiviral pills that are available by prescription only that can be given to patients within 5 days of the onset of their symptoms. Now, the problem with all of these treatments is they're all in short supply. So not everybody is eligible to receive them, and even some of those people who are just can't get their hands on them. But hopefully over the next few months, we're going to see an increase in the supply, and many more patients will be able to take advantage of them.
Yeah, and hopefully people won't need them as much going forward too. Dr. Mallika, thanks so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. And if you have a question for Dr. Mallika, you can reach her in one of 3 ways. First, email drmallika@cbs.com. You can also reach out to her on Twitter @Mallika Marshall, or send her a Facebook message at Dr. Mallika Marshall. David?